Which hormone is responsible for the release of milk during breastfeeding? Your options are estrogen, progesterone, oxytocin, prolactin, or prolactin. The correct answer is C, that is oxytocin. Oxytocin is the hormone responsible for the release of milk during breastfeeding by contracting the cells around the alveoli. What is the primary purpose of the first stage of labor? Your options are cervical dilation and effacement, delivery of the baby, explosion of the placenta, or engagement of the fetal head. The correct answer is A, that is explosion, cervical dilation and effacement. The first stage of labor is primarily focused on cervical dilation and effacement, preparing the cervix for the descent of the baby. Question number 23. Which statement is accurate regarding Group B Streptococcus GBS screening during pregnancy? Your options are GBS screening is done at 20 weeks gestation. If positive, intrapartum antibiotics are not recommended. GBS screening helps to identify maternal infections, or all pregnant women are automatically treated for GBS. The correct answer is C, that is GBS screening helps to identify maternal infection. The GBS screening is typically done around 35 to 37 weeks gestation to identify carriers and administered intrapartum antibiotics that reduce the risk of neonatal infection. Question number 24. What is the primary objective of antenatal education for pregnant women? Your options are to provide pain relief option during labor, to encourage cesarean section as a birthing choice, to promote informed decision making and overall well-being, or to minimize maternal involvement in the birthing process. The correct answer is C, that is to promote informed decision making and overall well-being. Antenatal education aims to empower pregnant women with information, promoting informed decision making and enhancing overall well-being during the birthing process. Question number 25. What is the primary purpose of the APGAR score at 1 minute and at 5 minutes after birth? The options are assess the mother's well-being, evaluate the newborn's physical condition, determine the need for neonatal surgery, or calculate the newborn's weight. The correct answer is B, that is evaluate the newborn's physical condition. The APGAR score at 1 and at 5 minutes after birth assesses the newborn's physical condition. That includes heart rate, respiratory effort, muscle tone, or reflexes and colors as well. Now let's move on to the question number 26. Dear friends, you are attending the most repeated MCQs on midwifery. And this is the second part of this series. I'm sure that you don't want to miss the first part. The first part includes lots of questions, lots of interesting questions on midwifery. If you want to attend the first part, then please click on this I button or you will find the link in the descriptions. Attend all the questions to become more fit for upcoming midwifery examinations. And do not forget to comment your score out of 25. And also, if you like the video, then please do like, subscribe and support. Let's continue. Which condition is characterized by a sudden increase in blood pressure, proteinuria and edema, typically occurring after 20 weeks of gestation? Your options are gestational diabetes, placenta previa, preeclampsia, or ectopic pregnancy. The correct answer is C, that is preeclampsia. Preeclampsia is a hypertensive disorder in pregnancy, characterized by a sudden increase in the blood pressure, proteinuria and edema. Right? So question number 27. During a prenatal visit, A woman in her third trimester complains of persistent itching, especially on her palms and soles. So what condition should the midwife be concerned about? Your options: normal hormonal changes, cholestasis of pregnancy, PUPP, or gestational diabetes. The correct answer is B, that is cholestasis of pregnancy. The persistent itching, especially on palms and soles, may indicate cholestasis of pregnancy, a liver disorder that requires monitoring and management. Question number 28. What is the recommended approach dystocia during delivery? Your options are: applying fundal pressure, encouraging the mothers to push forcefully, performing the Mac-Roberts maneuver, or administering uterine relaxants. The correct answer is C, that is performing the Mac-Roberts maneuver. The Mac-Roberts maneuver, involving maternal leg hyperflexion, is a first-line intervention for shoulder dystocia, helping to release the impacted shoulder. Question number 29. Which contraceptive method is generally safe and suitable for breastfeeding mother in the early postpartum period? Your options are: combined contraceptives, Depo-Provera, injectable progestin, intrauterine device IUD, or condoms. The correct answer is C, that is intrauterine device IUD. The intrauterine devices IUD, especially those containing only progestin, are considered safe and suitable for breastfeeding mothers in the early postpartum period. Question number 30. Which fetal position is associated with increased maternal back pain during labor? Your options are: left occiput anterior LOA, right occiput anterior ROA, left occiput posterior LOP, or right occiput posterior ROP. And the correct answer is C, that is left occiput posterior. Left occiput posterior LOP is associated with increased maternal back pain during labor due to the baby's position facing the mother's abdomen. Question number 31. What is the primary reason for administering Rh immunoglobulin RHLG to a Rh negative pregnant woman? Your options are: prevent Rh positive pregnancies, treat Rh negative mothers for anemia, prevent Rh isoimmunization, or induce labor in Rh negative mothers. The correct answer is C, that is prevent Rh isoimmunization. Rh immunoglobulin is administered to Rh negative pregnant women to prevent Rh isoimmunization, which could lead to hemolytic disease of the newborn. Question number 32. What is the primary function of surfactant in fetal lung development? Your options are: stimulating uterine contraction, preventing infection in the amniotic fluid, facilitating lung expansion and reducing surface tension, or regulating fetal heart rate. The correct answer is C, that is facilitating lung expansion and reducing surface tension. The surfactant in fetal lung development reduces surface tension, preventing alveolar collapse and facilitating lung expansion, essential for newborn respiratory function. Question number 33. Which factor is not a common sign of potential complication during the postpartum period? Your options are: persistent headache, fundal height at the umbilicus, elevated blood pressure, or uterine contraction. The correct answer is D, that is uterine contraction. Uterine contraction are a normal postpartum process. Persistent headache, elevated blood pressure, and abnormal fundal height may indicate complications. Question number 34. What is the primary role of the midwife in caring for a woman with gestational diabetes? Your options are administering insulin injections, recommending a high carbohydrate diet, monitoring blood glucose level and providing education, or initiating early induction of labor. The correct answer is C, that is monitoring blood glucose level and providing education. The midwife's primary role is to monitor blood glucose levels, provide education on diet and self-care, and coordinate care with healthcare providers. Question number 35. During a postpartum assessment, a woman complains of calf pain and swelling. So what condition should be midwife consider and assess for? Your options are varicose vein, deep vein thrombosis DVT, muscle strain, or ligamentous laxity. The correct answer is B, that is deep vein thrombosis DVT. The calf pain and swelling in the postpartum period could be indicative of deep vein thrombosis, a serious condition that requires prompt evaluation. Dear friends, it's the time to comment your score to see what's your learning level. And I hope that this video has helped you a little to prepare for your midwifery exams or practicals. And if you like our video, then please do like, subscribe, and please visit our channel for more videos related to nursing, medical, and midwifery as well. So thank you so much for watching. And now don't forget to comment your score. Thank you so much. Take care. See you next time.